Hi, I'm Dr. V K Chaitanya Rao, your sinus doctor. Today, I'll be talking about a minimally invasive sinus surgery procedure, balloon sinuplasty. Let me give you the outline for today's talk. I'll be talking briefly about sinuses and sinusitis. What is balloon sinuplasty? I'll be showing you the procedure of balloon sinuplasty, including a short surgical video and the equipment involved. I'll be talking about in which sinus conditions can balloon sinuplasty be used, the benefits and the disadvantages of balloon sinuplasty before concluding this video. Let us begin. So what are sinuses and what is sinusitis? There are 5 pairs of sinuses in our body present around our nose. There is a pair of sinuses above the eyes, what we call the frontal sinus. There are sinuses present between the eyes, what we call the ethmoid sinuses. The ethmoid sinuses present towards the front of the nose, we call them anterior ethmoid sinuses, and the ethmoid sinuses present deeply are called the posterior ethmoid sinuses. There are sinuses present below the eyes, that is behind the cheeks, what we call the maxillary sinuses, and there are a pair of sinuses present in the deep part of our nose above our throat, and we call these sinuses the sphenoid sinuses. The nose and the sinus cavity is lined by a thin lining which appears pink in color. This lining is called the mucosal lining. This mucosal lining produces a thin slimy fluid called the mucus, and this mucus is produced 24/7 in the nose and the sinus cavities. This mucosal lining has thin hair-like structures called cilia, and these cilia beat in a single direction, function like a conveyor belt functions in the airports, and clears the mucus produced in the nose and the sinuses. I can say this mucosal lining is the main functional unit of the nose and the sinuses. It is responsible for clearing the mucus being produced in the nose and the sinuses. In all sinus surgeries, a lot of emphasis is being put on preserving this mucosal lining as much as possible. When the mucosal lining is damaged, that area of the nose and the sinuses loses its capacity to drain the mucus. This is not a consequence we would like to have. Coming to sinusitis, I've already spoken in detail about sinusitis. I'll be touching on few points of sinusitis in relation to balloon sinuplasty. In sinusitis, because of many reasons, what happens is there is an obstruction to the drainage openings and the drainage pathways of the sinuses. Because of this obstruction, there is accumulation of mucus within the sinus, and this provides a good medium for the bacteria to grow, and this mucus starts turning into pus. When there is pus formation inside the sinuses, that condition is what is called sinusitis. So what is balloon sinuplasty? Balloon sinuplasty, I can say, is a game changer in sinus surgery. Balloon sinuplasty has been approved by US FDA in year 2005 to be used in nose and sinus surgeries. Balloon sinuplasty, unlike traditional sinus surgery, does not involve any cutting. There is no need for removal of bone or soft tissue in balloon sinuplasty. A small flexible balloon is passed through the blocked sinus drainage pathways, and these blocked sinus drainage pathways are opened and the sinus drainage mechanisms are restored. Let me show you how. So this is the animation of Acclarant. They are showing how the balloon works. Now the balloon, the guide wire is passed through the balloon catheter into the maxillary sinus on the right side through the drainage opening. We can see the glow on the right cheek. This confirms that the balloon guide wire is in position. Now we start pushing the balloon over the guide wire. We twist to the level of the maxillary sinus drainage opening. Now we are inflating it. This causes microfractures at the level of the drainage opening, permanently dilating it. Now we are withdrawing the balloon. Sometimes we can also push the irrigation systems through this balloon catheter into the sinus to give washes. This removes the bacteria within the sinus. So this is the surgical video. We are seeing the left side nose of the patient. We are able to see blood in this case because I've opened the ethmoids also for this patient. In ethmoids we cannot use the balloon. The white sponge is placed right at the level of the left frontal sinus So you cannot see the frontal sinus drainage opening at all. There's a lot of inflammation in that area. I'm pushing the balloon through the frontal sinus drainage opening. I've confirmed with navigation. Now I am dilating the balloon up to 10 atmosphere pressure, and I'll hold it for 20 seconds, once inside the sinus and once outside at the level of the frontal sinus drainage opening. So I have fast forwarded this for obvious reasons. So once I've done 2 dilations, I removed the balloon. You can see how widely the frontal sinus drainage opening has been dilated. There is, like you have observed, very minimal bleeding, and there is no damage to the tissue around at all. On the left you can see before, and on the right you can see after balloon dilation. In which sinus conditions can balloon sinuplasty be used? Balloon sinuplasty can be used in all types of chronic sinusitis patients. When the sinusitis involves the sinuses above the eyes, that is the frontal sinus, the sinuses below the eyes, that is the maxillary sinus, and the sinuses present in the back part of the nose, that is a sphenoid sinus, we can use balloon sinuplasty to open up these sinus drainage openings. Balloon sinuplasty, however, cannot be used for opening up the sinuses between the eyes, that is the ethmoid sinuses. So what are the advantages and disadvantages of balloon sinuplasty? Let us first talk about the advantages. Balloon sinuplasty is minimally invasive. There is no cutting involved. There is no need for removal of any bone or soft tissue. Also, the normal drainage mechanisms of the sinuses is maintained in balloon sinuplasty. There is reduced bleeding and post-operative pain experienced by the patient. Also, when balloon sinuplasty is performed, the recovery time of the patient is shortened and the patient can return back very fast to his normal activities. Not only this, there are certain sinuses which are prone to restenosis when the mucosal lining inside the sinus is damaged. This is especially true for the sinuses above the eyes, that is the frontal sinus. So balloon sinuplasty, when used for opening up the drainage openings of the frontal sinus, the chances for restenosis are very much minimized. Now let us talk about the disadvantages. The first disadvantage is the cost. The balloon we use for opening up the sinus drainage openings is a disposable balloon. That is, we cannot use this balloon in more than one case. So this adds up to the cost of the surgery. The second disadvantage is that the balloon sinuplasty can only be performed by an experienced sinus surgeon who knows the anatomy of the nose and sinuses like the back of his hand. If the balloon is mispositioned, it can sometimes lead to injury to the orbit, that is the eye, or it could fracture the skull base, that is the partition between the nose and the brain. And once the skull base is fractured, the CSF fluid which cushions the brain starts dripping through the nose, and this is a complication we would not like to have. At our Sinus Doctor Center at Dr. Rao's ENT, we use navigation technology to our advantage to locate the sinus drainage opening before we pass on the balloon. This greatly reduces the chances of complications of balloon sinuplasty. In conclusion, I can say balloon sinuplasty is a safe, effective, and minimally invasive alternative to traditional sinus surgery. If you or your loved ones are suffering with persistent sinusitis symptoms, it is advisable for you to have a discussion about balloon sinuplasty with your ENT surgeon. Remember, there is no need to suffer in silence with chronic sinusitis symptoms. You can use options like balloon sinuplasty to breathe easy again. Thank you so much and namaste.